All right, this is Eric Housley with another episode of Lessons in Loss, Love, and Resilience. And I have a new friend here, Charlotte Grinberg. And Charlotte, I happened to read an article that my wife had passed on to me and got your name. And then I reached out on LinkedIn and we've had some great conversations. So I appreciate you joining me today. You want to introduce yourself?
Definitely. Thanks for having me. So I'm Charlotte. I'm an internal medicine doctor. I live in Washington, D.C. with my husband and five kids under the age of 9. And I specialized in end of life care for a few years, and now I'm transitioning to having a primary care practice focused on improving health span and longevity. And I love practicing as a doctor, being a mom, wife, and writing. So it's
That's
great to be
awesome.
here.
Yeah, it was funny. You should have seen my wife's face when I told Hannah, I said, "Oh, by the way, the article you shared to me." She shared it to myself and our son Alex because he's doing his master's in sports psychology.
Hmm.
And so she shares this article from Psychology Today, and I just happened to look you up on LinkedIn. After I read it, it really resonated with me in it. And one of the primary things that I remember that jumped out was it was talking about how people assume because you were dealing with end of life care so many people that must be so comforting to be there in those moments, and you were like sometimes. At least that's the way I understood it, right?
Yeah.
I know with my book coming out and doing the public speaking, I more often than not people say, "Oh, that must be so cathartic." And in some ways, yes, but that's not why I do it. It's more to help people to be there. And there's times where the conversations are good and the times where they're not. So why don't you tell me a little bit about, like how the article came around and your work as an end of life care doctor and intern.
Definitely, yeah. I think so many people will just tell me like, "Oh, it's so meaningful that you take care of people like in their final moments of life when they're like elderly and like surrounded by family members and things are so peaceful." And I think like it just showed sort of I think the lack of experience and knowledge about what dying and end of life care actually looks like. And I think part of having that fallacy actually contributes to a lot of the stress and anxiety when people actually go through that experience because it is oftentimes not like that. And then people like are very anxious because they're not used to it, and then they think that something is like wrong because it's not what they imagine it would to be. So I'm trying to just like normalize the messiness that exists to like have people actually feel less anxious when they're experiencing that, so that people feel less like I'm doing something wrong or like this is not normal, or I think it contributes to a lot of the negative emotions that people experience with the actual seeing of the dying process.
Yeah, I would imagine. And I mean, even just, I always say it a lot is what we fear the most is what we can't control, right? And so I think we've all envisioned or have thought about how, I know my dad goes, I just want it to be quick, like kind of a thing. And then we have friends who pass with a long illness like cancer or something. And it's like, it really allowed us to spend the time and say the things we wanted to say. And, for us losing Elena in such a way, so young and all too, it's, you could look at both factors, right? So in your scenario, I mean, I know it's hard to give a percentage, but is it more often than not that it's more hectic, or how would you describe what you were doing so primarily in the end of life care?
Yeah. So I think a couple things. Like one, just to normalize, like it oftentimes doesn't work out the way that people anticipate or expect, right? I think, like you're saying, most people I think they're going to just die of old age, like peacefully and quietly in their sleep. And I guess I don't take care of those people because they do just pass peacefully and quietly in their sleep. But there's so many people like on hospice and needing end of life care where, they're in their 20s or 30s and got like metastatic cancer, or they're in their 60s and 70s and had an acute illness or accident, like falling off a ladder or slipping in the shower. And so I think there's a lot of like suddenness that happens, or like this feeling of like this did not work, like happen the way that I expected it to happen. And then there's a lot of anger and frustration with that. Whereas like for me, I kind of have the approach that it's like it happens the way it is meant to happen, right? And that is like the journey that we are going to go on, and we should walk that journey. And it might be hard and sad and difficult, but I think what contributes to the chaos is this like feeling of like injustice, right? Or like that this is not the way that I wanted it to be, and then that can lead to a lot of anger and frustration. And so even when people like are past, like their death process is slow, And the way that you framed it is like, well, that's an opportunity for more time together and for like connection and memory making and like, processing that death and working through those emotions. A lot of people actually express frustration over that, right? Because like they're like, why is it happening so slowly? Like, this is not what I wanted. This is not what I anticipated. And so they have a very negative mindset about the experience because, again, I think they just had like a very specific vision of like, well, how things were going to play out.
Yeah, that makes perfect sense. I mean, ultimately, we all do this grief thing different, right? So while one person may appreciate that time, the next one absolutely doesn't. you know, and then I would imagine the degree of pain that the person is going through as well, let alone the emotional side. Yet at the same time, I don't know about you, but I don't know there's any time in my life where I've pictured something or envisioned what I thought it was going to be, and it actually worked out the way that I thought it was going to be, right? So,
Yeah.
um,
And then I think this like, so the lack of control that people then end up experiencing manifests, unfortunately, in like a lot of like, again, like I call it like these like negative emotions or like negative actions, right? So people are trying to like search for ways to control the situation, which oftentimes will like manifest in like micromanaging, right? So like trying to like micromanage like the medical aspect of the care, or micromanaging like family dynamics, or micromanaging the emotional part, or trying to be in like denial about it, or overly optimistic, right? Like I think people at the end of the day, like for me, all of this like human behavior I see is just like people expected something to be the way that they expected it to be. It's not working out that way. So they feel a deep sense of loss of control. And now they're trying to grapple and figure out any way that they can control the situation.
no, it's a very good friend lost a grandchild, and and it was the baby was very young. There was a lot of medical things, sadly, and we showed up, and I saw her just bouncing around the house, taking care of everybody, cooking and everything else. And I walked up to her, and I gave the same advice that was given to us when we were notified of Elena's murder, and officially. And I said, "Hey, you, if you need to go for a walk, go for it. Like, you don't need to take care of everybody else because all you're doing is suppressing and trying to not think about it. And if you need, and that's okay too, if that's what you need to do right now, but don't be afraid to take the time you need because you're also grieving." And I think she appreciated, like we talked a little bit after it. And I can say those things a lot easier than a lot of people can because of, what we've gone through is people give me a lot more leeway, which, I mean, that could be good or bad. I try not to take advantage of that. At the same time, I could see her trying to not process. And like I said, the chaplain looked straight at us when we had just been informed and said, "Hey, if you need to eat, eat. If you want to go for a walk, go. Don't worry about next week. Don't worry about next month. Like that'll come. Deal with right now." So I could imagine a lot of the people going through like it's not going as the way that they planned it, and having to just almost accept that more than anything.
Definitely. Like I feel like I can walk in the room of a person and their loved ones, like the person is dying and their loved ones, and I can like immediately tell like how much end of life care experience or how comfortable this family is with death and dying. And that's based on like the ability of those people to sit still, right? To just be like present and listening to music, or like participating in life review, or looking at photos of the person, even like joking around, just like sort of very casual, like calm. Like they bring in a lot of like photographs from the outside world or objects that was important to like the person, or a blanket that person loved, even like pets being around. Like you can really feel the vibe of a room and tell like, okay, this family is like understanding and accepting and has experience with end of life care, and they're leaning in to this like very emotional intense life event and trying to like create connection and be present. Whereas like when I walk into a room and it's like they have like 100 questions about the dosages of the medications and the frequency and like what are we doing and what the plan is, and they haven't eaten in like over a day, and they haven't slept, and they haven't gone to the bathroom, and just things feel really like tense and stressful. It's like I just feel like they just don't know what they're in for. And so in that moment, the best thing I can do actually is to tell that person to try to take care of themselves, right? Is to just say like, we have, like we have to have you take care of yourself, and also to really spend a lot of time providing education about what normal dying looks like, and to normalize the experience that they're having, and just provide like information and education because they just don't know.
Right. Do you, I mean, and we all have our theories in this way, right? But do you see, like, is death similar, like, to birth? Is it a part of the process? Like, is that how you kind of envision it as somebody who's standing in front of these people, having to have these conversations in the good and the bad, right? Um, how,
Definitely, yeah. Like I think I talk about this a little bit in the article, that like they're very physical and very emotional processes that like are transformative, right? It's just like a huge life event for someone, and can really redefine like someone's whole identity and purpose, and just form really intense connections with like the people who are present or related to that experience. It's also very physical in the sense that like, natural childbirth is like really painful. Seeing someone have contractions, and
how
there's
would you know you've only had five
yeah,
children?
yeah, I have fun. Yeah, and I've done natural childbirth for all of them, and it's like there's a lot of screaming, right? There's like a lot of screaming and a lot of yelling and like a lot of self doubt, and like it's very emotional. It's like really intense, but I think through like the physicality of that experience, you like I don't know, you reach like a higher purpose, or like higher like sense of self and like your soul, and it's very connecting, and so. I feel like death is very similar. I think also like I've definitely had in seeing so many people die, like I think I very much like believe in the afterlife, I would say. Like I think that's just me, right? And just like having these experiences that like don't feel medical but feel very like spiritual and like supernatural. And I think that's actually helped me appreciate the birth experience and then also the death experience, because this idea of like we're entering, we're exiting one world and we're entering a new world. And so birth very much feels like that, like we're exiting the world of the uterus and we're entering like the human earth world. And then when we're leaving this world, it's like there might be so many other opportunities and experiences like for that soul that I can't understand because I don't have like a physical understanding of it. But I think seeing that way makes me feel less afraid, or like less of a sense of a finality. I don't know what like your thoughts are about it
No, it's
related to
funny.
your daughter, but
Yeah, no, no, it's funny because I struggle with with the phrase God has a plan, especially the way Elena died. Like I struggle with that in terms of, is there a finite amount of time, whether I die in a car accident or I die from cancer, I'm going at a certain point. Like that's how it works in my head. And unfortunately, sometimes these culminations all come together. I like to use the phrase like organized chaos, But I walked and I was gonna, ironically, I was going, gosh, how do I work this into the conversation? Because I am super interested in NDEs and afterlife and things because, we don't know what it is. We all have these assumptions, kind of like you were saying with how this person's death was supposed to be. Like you pictured it a certain way and it didn't happen. And I was going to ask you specifically that, and you just kind of jumped into it, which I love it. Is like, do you have an example that you'd be comfortable, or some stories of what have you witnessed that has made you go, oh my gosh, like
I
this.
think people just like really see their deceased loved ones, like they really visualize them, and they feel like they're calling out to them, and they feel like they're reaching out to them too, and they're able to like articulate that. And that can even be in people who like have had dementia for a very long time, right? And like shouldn't really be lucid, but they'll have like the medical term for it is like terminal lucidity. So like as they're nearing like the end of the life, they have this like these moments of like immense like clarity, and they can even recognize their like loved ones who are alive, but also like deceased loved ones. And so I don't know, I think there's just something about like people being able to like talk to and talk about people who have died in their life that they haven't really talked about or thought about in a very long time. And it can really freak families out, right? Again, like I think if people don't have like comfort around this or a framework for thinking about it, and they haven't experienced it before, they can really like pathologize what they're seeing, right? And like call it like hallucinations, that like need to be medicated. But I think for me, I kind of try to lean more into like the sort of spiritual part of it. And then, I mean, you see amazing things, right? Like people, like dying on certain anniversaries, or, you could argue like, okay, well, this is people just like trying to make meaning of what is a random event, or like you could try to search for the more like sort of spiritual, like deeper meaning behind it. And so I opt for like the latter. But I think this is very different than like the situation of a tragic, unexpected like murder, death situation.
Yeah, yeah, and at the same time, there are the similarities where, I mean, I ended up reluctantly speaking to a medium. I was like, I don't know, like I was in a
Mm.
very, tough place trying to sort stuff out a few months after. We had had some random messages come through, like to me personally on Facebook of people that had visions in their dreams of Elena. And I'm like, and then one woman's like, oh, by the way, do you have two brown dogs? And we had two chocolate labs at the time. I was like, yeah. She goes, well, in my dream, like and she starts giving these things that were super specific. And I spoke to this medium, and it was funny because there's a lot of people that have said, especially Christians, that say, well, that's not real, like that's the devil and that's this and that. And I look at them and go, it's funny, it brought me closer to my faith. Now I struggle with the whole faith and religiosity. To me are very different, yet they're
Hmm.
connected, but they're very different. And so when you talk about how they passed into the afterlife and such, I there's so many definitions of all these different religions. I try not to get into the specifics of that and more focus on the, like having that. So I would assume people without faith really need scientific type answers to what's really happening. Oh, they must be having hallucinations. Example, one of my uncles, had been sick his whole life, and his wife, who is the healthy one, all of a sudden died. And 9 days later, he then passed. And we thought he was going to pass for a decade. I mean, he was that elder, sick and all for years. And it's almost like you've heard of those couples who,
All the time. I can't tell you how many death certificates I complete in a week or a month where it's like two cup, like a spouse. I always tell my husband, like, I'm definitely going to die of like broken heart syndrome. Like, I know, like, I'm going to go when he goes just because like I've seen that so much and like it's definitely my personality. And I feel like just so physiologically and emotionally like dependent on him. We've been together like since we were 17 and 18. And so I don't know, but I just kind of like lean into it, I guess. Like, I have an awareness of it. And so I kind of like joke about it, but also with our kids. And I don't know, I'm just trying to like normalize the fact that I really think that this is like what my
yeah.
fate is.
Well, and if it doesn't happen that way, Charlotte, don't be too disappointed.
Exactly. Yeah,
Yeah.
that's true. That's really good
Um,
advice.
yeah, it's those experiences to me are so mind opening, as we all get, every day we're a day closer to our last day here, right? And so seeing my parents as they're getting older and others, it's like there was the thought for me that says, is it more of an encouragement towards understanding their own faith or their own belief in that, or is it more of understanding that it's like, just because we don't know what it looks like and we can't control it doesn't mean we're not going to be there. So what I was getting at when I threw out the concept of the medium, there was a point where she had said that when like she got actually extremely emotional, like she goes, I'm so sorry, I've never, because I think she was kind of feeling what Elena went through, or witnessing it. And she had said that some of our loved ones were with her when she was passing. And so she was very comforted at the time and all, which as a father and at the tragedy, it like made me feel better in that way.
Hmm.
And, you could argue, okay, that's all BS or whatever if you want to. But for me, I'm okay to accept that and know a lot of factors. And hearing so many examples of people that have passed that start all of a sudden coming out super, like, I like the term terminal lucidity. It really does kind of resonate of why it's used in that fashion. That's pretty amazing.
Yeah, and I just like, again, like I'm trying to see like it's it can be a moment, like the death experience like can be, again, it's like there's so much sadness and there's so much heartbreak, right? And like loss and grief that you have to work through. But there is also like a lot that we can learn, right? And like grow from and inspire us to like be better and do better and like value our own lives and our own relationships and like our own identity and our own experiences. And so I try to focus on both of those things. And I think like I just seen like, again, it's like I would say like people who have had prior good death experiences are the ones who have future like good death experiences. And so the experiences matter because I think they have like a cumulative effect. And then I would just say like people who have a like a spiritual or religious or like faith-based framework tend to handle like that part of the life cycle with a lot more like calm and like resiliency. And I found that like really inspiring, right? Like I just remember someone like sitting at the bedside of his mom and just saying like it's such an honor to bear witness to her like soul transitioning to like the next world. And he was so like just calm and loving and like present and had gratitude about the situation. And that feels just so different to me than the person who like feels very like lost and confused and anxious and like angry and all of those things. Like I just think between those two people, like one's going to have a much harder time with like the grief experience than the other.
Yeah, for sure. And do you, I mean, obviously you've witnessed plenty of both, probably more, I would assume more of the anger because the people, it's just that unknown, right? That,
Yeah.
we struggle to allow allow those types of things in. But I guess in your side is what would you suggest to someone that's, like how do you communicate with and to others? So let's say I'm handling it well and my wife or somebody next to me is really struggling. I'm sure you've seen different parts of the room as well. Like, what any suggestions on how to communicate with people in these moments?
Definitely. I think in the moment, like, and it's really challenging because people are so activated, like they're in fight or flight mode, and so their ability to just like absorb new information is very limited. And so I think one is just like giving people the time and the presence to be able to share and process what they're thinking. And so a lot of it is just like asking questions, like trying to understand like what they are worried about, right? Like I think a lot of people articulate a fear that like their loved one is suffering, that they're starving to death. Like that's another big like concern. They're very angry towards like the medical establishment or system about like the experience that they had in terms of diagnosis and like treatment. They are sometimes angry at that person, right, for like how they did or did not take care of themselves or like communicate things. They are reliving prior deaths that they experienced that they completely suppressed and like didn't unpack and like work through. And so I think there's a number, or they're feeling their own guilt, right, about not being present or being around or being, like, so there are a lot of things. There are basically a lot of very individual life experiences that have spanned decades that are now manifesting in like anger or guilt or denial or frustration. And so I think just trying to understand what that is, like trying to get people to articulate it. And it's just about asking questions. So I just like, I'll just ask like, oh, like what's on your mind? Like, what are the things that are like running through your mind that like you're afraid to ask or like you're worried to ask? And I'm happy to like, I've heard everything. So I'm happy to just like
Yeah,
listen and, and then I just ask like, what are prior deaths that you've experienced or like, what are you feeling like angry about? And then having people articulate that. The answers are like pretty like typical. Like I then just like describe what the normal dying process looks like, like just spend time describing that. And again, just like the messiness of it, the uncertainty around it, and then what does it like physically look like? So my eventual answer is like pretty much the same to everybody, but first we have to like walk that path together for them to like unpack and figure out like why are they feeling the things that they're feeling, and then they get a lot of like comfort from just knowing that like this is normal, what is actually happening.
it's funny that you say that because for me, I've noticed in the last, let's say, decade. So we're members of Kaiser out here in the West Coast, and I've noticed I used to go, gosh, their service is just it's everything is just pushed down. Like, how can we not serve you to because it's a business, right? And there's so
Mm-hmm.
many costs that go into it. And I've really noticed in the last, especially pre-COVID, but let's even say the last 10 years, that the doctors now like frequently will take the extra time. It used to be like I felt like I had an 8 a.m. appointment and it was 9 o'clock when they'd finally walk
Mm.
into the room, and then 9:03 they're like, okay, thanks, bye. Now it's like they're reaching out, they're asking questions like, do you have other questions? And at least it makes me feel heard. And it allow, like we all have different questions, right? So taking the time and being empathetic like you are in those moments, the way it sounds is really important to people, I think, because they feel heard.
Mm-hmm.
Because you just don't know what, like I might look over at you and say, oh, I've already dealt with this with my mom. Now this is my dad. So thank you. No, I'm understanding versus somebody else might not have, right?
Mm-hmm.
And I'd say that, in our scenario, I had witnessed, I mean, I had 5 people near my age that I was very close to die since I was like 8 was the first
Mm-hmm.
one. And so I had seen that, and I've met people that were like, I'm 43, and other than a great grandparent, nobody's ever passed in my life. And so my understanding and ability to kind of realize that this is real,
Mm-hmm.
and that people can pass, that it's really kind of eye opening for some.
Mm-hmm.
So,
Just in general, like I'm in trying to encourage more people to like go to funerals when you can, right? Like even try to volunteer like at a local hospice. Some, if you're part of a faith community, like a lot of religious communities actually have very specific burial practices for preparing a body for burial and for funeral. And so like people actually volunteer to do that, depending on like your religion. And so that's another way of like feeling close to death and like seeing death and like starting, or or try to read about it, or I mean even listening to this podcast, right? Like just the more that we can like expose ourselves as like individuals, like it does improve comfort with the reality of it. um I think the hard part for me is like what I explained to you is like, I was able to do that for people who are in crisis, but it takes a lot of time, right? It takes like hours of like being present for somebody. And even then it like may or may not be effective, right? Because I feel like they're just, again, it's like the fight or flight mode, and they're in crisis, right? And they're so stressed, and like it might take them years to process like what was shared in that conversation, and requires like ongoing like sort of conversations and talking with grief counselors and things like that. So I think for me, like that's why I made this like professional change, like trying to move further upstream, because I think the all of the chaos like really got to me. Like it made me very sad, because I was like, it could be so much better for people, right? Like people could be entering this kind of experience with a lot more calm and knowledge and expertise and like empowerment. And so I've like now I want to like be that doctor who has like relationships with patients over decades and really knows them, like really knows them and their family and their personalities and what were those prior experiences that they've had with death, and create that like trust and knowledge, and support that I think is really essential to carrying people through that stage of life.
that's awesome. And I mean, I would encourage you, obviously, you have 5 children and a husband and a life, but I would encourage you to not stop writing. I think your experiences really are something that's very valuable that a lot of people don't. I similarly, in my scenario, people ask a lot, and I look at them and I go, partly why I did the book was, I mean, it's an expensive endeavor, right, for me to do it, but everybody that had somebody that passed, because of how I kind of communicate, they started going, well, hey, can you speak to my friend? Can you speak to, and I don't mind, like I'm happy to do that and speak to people. But all of a sudden, Hannah looks over at me one day and she goes, Eric, like you're spending 3 hours a day, a couple times a week with people like that have just lost a child, or, like, or they're struggling with this. And she says, I can see it's just emotionally drain. And she goes, you're not getting paid to do this, which is totally fine. She goes, but I can see how it's draining you. So she goes, you should consider writing a book, because then you can also share that. Some people, and I would say some want to speak, some want to listen, like on the podcast, and some want to internalize or read or something. So to kind of wrap their head around it, because we all learn differently and process differently. So I suggest, or my encouragement to you would be is to still write or do things in that way to help people in this process. And it doesn't have to be, the encyclopedia, right? But I mean,
No,
even
definitely. Yeah. I remember reading this like fiction book like a year ago called like We All Want Impossible Things, and it's about her friend like talking about caring for somebody who is in hospice. And it was like actually the first time I read in a book, like in a fiction book, or like seen, like we don't see it in a movie, like what it actually is like to see a hospice facility, right? To like what does the room look like, and what does the care look like, and what are the logistics, and what are the kind of symptoms we treat, like, and it was so like cathartic even for me to read. Like, I was literally crying, just being like, somebody understands me, like somebody knows what I see every single day and experience, and it feels so lonely. And so when my nephew died when he was like before he was 2 years old, and he was very chronically ill for his life. And I remember like the thing that helped my brother-in-law and sister-in-law the most was reading books written by parents who had experienced child loss under like as similar circumstances as possible. It was like the only thing that made them feel like, okay, somebody like gets what I'm going through and like connect to me and give like helpful advice. So it is really important. It's like that I think that's like the greatest source of support that we can give for people.
Yeah, and I think for you it would be a people that like myself. Like I think for me, seeing that I wasn't alone. Like I remember when we got the phone call from Pepperdine University of the act or of the incident. The first thing that came out of my mouth was how many other students are still missing. And I wanted to hear, oh, there's still, 30 students that are out and around. Like they're in the hospitals. We're trying to figure it out. And she said to me, none, just Elena. And there was a sense of
Oh.
relief, which
Mm.
I would have never imagined, right? Like
Mm-hmm.
instead of that anxiety to come over, like there was a sense of relief, partly that I think the only way that I could describe it is that no other family was going through what we were going
Mm.
through in that moment. And so I think ultimately is not only for you is the people that can relate to someone who's witnessed so many of these experiences, but also somebody in the medical field. Because the one thing I have heard from a lot of people is a lot of time the bedside manner of that physician or of that person in the medical field isn't quite expected. And again, like just for you to teach them to or encourage them to take the time to let them ask the questions, give them the time right now because they need that, and it costs time, which is hard in what you guys do, but that time just to make them feel heard
Mm-hmm.
is really, I would assume
But it
that's
makes all the difference. Like because I remember like when I didn't have that time, or I didn't prioritize that time, and like we would get caught up. Like I get caught up with patients and families about these like very technical discussions, right? It was like about like which medications and like what is the imaging plan and like what is like very 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 specific and like very medical. And it was only when I like stepped back and been like, what is driving this, right? Like why is it like what is actually causing the manifestation of this like concern, that you could like really get to like the root cause of like the issue, and then discuss that and resolve that. And then it would lead to like a much better patient physician like interaction. And then like you succeed more with that, the plan of care.
Yeah, yeah, absolutely. And I would assume, and again, this is my assumption, but I would assume that a lot of that is well, let me. The only thing I can control right now is what meds is he on or she on
Mm-hmm.
and why. And like because they're trying to show like I love this person. I want to make sure I want this to go on as long as possible and keep them here. And I mean, to me, gosh, a little over a year ago, my father was at a point where my mom and I left the hospital, and we looked at each other like, I don't know if he's gonna make it. Like he had gone through hospital dementia. I mean, it was actually a very
The
funny.
delirium, right? It's like, yeah, hospital
Oh
acquired
yeah, it was
delirium.
it was
Yeah.
hilarious. My dad looks over and we kind of look at each other. We're like, what's going on? And he'd been dealing with a lot of medical stuff, right? And we look over and we call the nurse in, and she goes, "Is everything?" And we're like, "Something's wrong." And so she starts asking him questions, and she's like, "What's your name?" And he says his name, and she's like, "What's your birth date?" And he says it, and then she says, she goes, "And who is this?" And he's like, and points to my mom, and he says, "That's my sister." And I was
Mm.
like, "Well, A, you're an only child, but you're like, is he being funny? Like, because he likes to try to be funny sometimes." And then she's like, and then she says, "And who's that?" And that's her brother, pointing to me. And then she's like, okay. And she's like, "Oh, is he joking?" And then so she asks his birthday again, and then he gives like some 20 years prior, and then she asks about me again, and she says that I'm I'm married to my business partner, Justin. And all of a sudden I was like, okay, I'm now homosexual. And my dad's informing him, like, what is happening right now? And then after, like, I walked into the hallway and she goes, we think this is hospital delirium, but it also could be like, I guess, septic or something where, like, there's different things that could be happening. So they immediately took him for a CT. But the whole experience was, we as a family still laugh about it and tease him because he doesn't remember any of it. But it
Mm-hmm.
was my mom and I were laughing, going, what is like,
Yeah, but it's really good, honestly, that that nurse was able to identify that for you, right?
yeah,
Because like a
yeah,
lot of people don't, and then they think that there's like something, you know what I mean? They like start taking what their loved one is saying for like as literal, right?
yeah.
But it's not, and so
Yeah. Yeah, no, it was, the experience that we were there for. And fortunately, like he's back and going, and they're on vacation and enjoying a little bit finally for the
amazing.
first time in a long time. But to see those people take the time and really do it, and that's a pretty amazing experience to see it. So, well, Charlotte, I can't thank you enough. I know
Of
you should have
course.
you should have seen my wife's face when I told her. I said I randomly reached out and that you had responded, and she's like, "That's awesome that you're going to
Yeah, I
talk."
love connecting with people. It's like it's so nice to hear from readers. Like I think because I do write about things that are so like taboo, that people like are grateful and they feel like I a lot of people do reach out with their very personal stories, which is like so beautiful, right? Like people they're like, "Oh, okay, this person's like comfortable to hear about this," right? And it's a lot of times things that people haven't shared with other people because they're like worried about the like stigma or the discomfort or the uncertainty or the unknown. And so I think for me it's really lovely to like connect with people because I often don't get to hear like the after for me, right? It's like I take care of people in this like really intense moment in life and then I don't see them like again, either like they've died or they're like, their family members have like moved on. And so I don't get to like hear what the long-term experience is of going through that death, but I do get to experience that through readers. And so I'm very grateful for that.
Yeah, that's awesome. And again, thank you for your work, and I hope you do continue to write in, like in these.
Definitely. Yeah.
I think it's very eye-opening for people. So I really appreciate the time, and thank you, Charlotte.
Same. Thank you so much.
All right. Have a good day.
You too.